Most people think that they would notice if something was seriously wrong with their vision, but glaucoma doesn't necessarily work that way. It often begins very slowly, affecting the very edges of one's peripheral vision, while the central vision remains intact. And because we use both eyes together, one eye can fill in for the other without you realizing that anything is missing. Glaucoma is not a single disease. It's a group of conditions that deteriorate the optic nerve, or the cable connecting the eye and the brain. This nerve carries every single image you've ever seen. When it changes over time, that loss is permanent. Many health conditions can affect the optic nerve. Inflammation, infections, trauma, genetic conditions, things like diabetes. But glaucoma is unique because it usually progresses quietly and often without symptoms. People often associate glaucoma with high eye pressure, and eye pressure does play a role, but is only one part of a much bigger picture. Some people develop glaucoma with pressures that are in the normal range. Other eyes can tolerate higher eye pressures without any damage to the nerve at all. Age, ancestry, family history, eye trauma, certain shapes of the eye, long-term medication use such as certain steroids. These may increase one's risk of glaucoma, but they don't necessarily guarantee it. This is why no one should assume they don't have glaucoma purely based on how well they see. The only way to know for certain is through testing. Eye doctors use several tools to understand the health of the optic nerve over time. Retinal nerve fiber layer imaging and visual field testing are just two examples. These tests can reveal patterns of vision loss long before a patient can sense anything is missing. If glaucoma is diagnosed, the goal of treatment is to lower the eye pressure to a safe and personal level that slows the disease. For some, this may mean prescription eye drops. For others, it may mean a laser procedure to help drain the fluid more effectively inside the eyes. And in certain cases, surgery may be used to create new pathways for that same fluid to exit the eye, all effectively lowering the eye pressure. Each option has its place. Treatment plans are tailored over time based on how the optic nerve responds. What makes glaucoma challenging is not that it can't be managed, because it absolutely can. The challenge is that delayed testing delays one's diagnosis, and delayed diagnosis means damage that cannot be reversed. So if your eye doctor recommends additional testing to rule out glaucoma, it's not to worry you, it's to protect the vision that you rely on every day, including the parts that you cannot see that are slipping away. Poor outcomes, such as complete blindness and low vision, are possible with glaucoma. However, with early detection, effective treatment, and consistent follow-up, many people with glaucoma do retain useful vision throughout their lives. This video is for education purposes only and is not a substitute for a full eye examination. As always, thank you for your viewing support. Please like, share, and subscribe.